For our clients who live in Los Angeles, living in one of the biggest major metropolitan cities in the country means they start to have a huge variety of Medicare options available to them. But be this as it may, there are always questions about what is the expected cost of one's Medicare. And that question is sort of complicated by the maxed out offerings available in Los Angeles County. But today, we're going to be putting together a survey of plans to figure out about what someone could expect to pay for their Medicare costs in Los Angeles in 2025. Hi, I'm Michael, and this is Michael's Medicare. Any of you or somebody you know has questions about their Medicare options, whether it's AEP or really all year round, please feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to assist you over the phone or in person at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe. So as we delve into what is the Medicare cost in Los Angeles in 2025 for health plans options, let's first talk about what are those fixed costs that folks will have to pay. Everyone has to pay. Because many of the Medicare options have low monthly costs or even $0 monthly costs, but that isn't the complete cost story. This is because for things like Medicare Advantage plans or Medicare Supplement plans, in order for someone to enroll into them, they must have and maintain both Medicare Part A and Medicare Part B. Medicare Part A doesn't have a cost, as we all pay into it while we are working, but Medicare Part B does have a cost, and that's $185 per month in 2025. And this has to be paid every month in order to keep the full Medicare coverage and also to stay enrolled in the Medicare Advantage plan options if someone enrolls into those. So whatever costs we're going to be talking about, we're going to have to also continually add the Part B 185 to get the full actual cost for Medicare in 2025. So let's talk about some of those numbers. The first corner of the Medicare plan options we will talk about in Los Angeles is going to be the Medicare Advantages that are HMO plans. And Medicare Advantage plans are private health plans that are offered by some of the largest carriers in the country to folks who have both Medicare Part A and Part B enrollment. What this means is that by choosing a Medicare Advantage, it is possible for beneficiaries to get all their normal original Medicare benefits covered under the Medicare Advantage plan, but also they will often throw in some additional benefits, things like dental, vision, gym memberships, and the like, even at no additional cost. But when we talk about MAPD plans in Los Angeles, the vast majority of them luckily do not have a monthly premium. So that is $0, and that's always a popular option. But the plans that do have premiums will usually have larger doctors' networks, larger prescription medication offerings, and lower costs and copays on benefits, and that is where those extra dollars end up going. Meaning if someone is looking at a plans that do have a premium on the low end, the lowest set cost in Los Angeles in 2025 for an HMO MAPD is $22 a month. That is the Scan Prime plan. While on the high end, the premium can be as high as $49 a month with the AARP Medicare Advantage plan. When we average out all the HMO MAPDs that have premiums, the monthly average premium comes out to $34.20 a month. So if we add that to the $185 for the Part B, that would mean that the average expected cost for a Medicare beneficiary in Los Angeles in 2025, $219 a month. Now, the other half of those Medicare Advantage plans that mostly do have premiums are going to be Medicare Advantage plans that are preferred provider organizations, or in the PPO format. These types of plans are similar to HMO plans with one major exception, is that enrollees can go to doctors who are also out of network, who are not directly contracted with the insurance company. Now, even though those out of network doctors are available and usually are doctors at networks who are in high demand and thus don't have to accept the lower HMO payment plans, usage of these services do tend to come at a much higher additional cost to the beneficiary. That being said, when we look at the highs and lows cost for PPOs in Los Angeles, the lowest cost plan that I could find was $11 through the Humana Choice PPO plan. And the highest one, $45 for the Alignment PPO, which actually puts the average cost a bit lower than the HMO at $32.67. But just keep in mind, there are far more HMO plans that have $0 premiums that are great options versus the PPO plans that mostly have some sort of monthly premium. Furthermore, more of the usage costs on a PPO plans are moved to the beneficiary, so the premium may not be surprisingly higher, but added in the higher usage cost, it still could result in overall way more money being spent by the beneficiary for their services. Lastly, add that in with the $185 Part B monthly premium, that comes to $217 per month on average. So pretty close when we just look at the numbers, but of course there's always more to it. Now last of the day, let's talk about the wild, wild west of the Medicare world, which is the Medicare Part D plan, or PDP plans. These are standalone Medicare plans that only cover prescription medications. They don't cover doctors, they don't cover hospitalizations, they don't cover emergency rooms, or any other healthcare stuff. That is all still going to be done through Medicare Part A or Medicare Part B or Medicare Part A and Part B. But these Part D plans just cover prescription medication. And they have a very wide breadth and width of types of medications and cost on them. That being said, the monthly costs can be wildly different. For example, for the highs and lows, on the low side, there is the Cigna Healthcare Assurance Plan that has a monthly premium of $1.80. Not too bad, right? But when we look at the high-end side, the Blue Shield RX Enhanced PDP, that just sounds expensive, it has a monthly cost of $183.50. And that is just for the medications. Why the larger difference, you may ask? Well, the deductibles, the numbers, and types of prescriptions that are available, the leniency of authorization of those medications, all that kind of factors into the pricing, meaning that higher price plans may have more options for specific healthcare needs or not limit access to expensive medications in the same way as the lower cost ones do. Either way, the average monthly premium is $104.55. So if someone is going to go the PDP route and just keep Part A and Part B coverage, it would mean that their average monthly cost with the Part B, the $185, added together comes out to $289 a month, even if they never use the coverage. That is just to have the coverage, not to actually use the coverage, which is, needless to say, gonna be pricey. Overall, we can see that the cost for Medicare is slowly, maybe even quickly, been creeping up over the last couple of years, and even more so with the number of folks retiring and utilizing services to a higher degree than ever before and really ever expected. But whether someone is trying to decide if HMO or PPO or just PDP is a good option for their Medicare health plan options, please feel free to reach out to us at the information down below, and either me or somebody from my team will be happy to assist them in person over the phone at one of our many offices across Southern California in English or Espanol. Also, don't forget to like and subscribe. So for Michael's Medicare, I, of course, am Michael, hoping that you have a great rest of your day, and goodbye.